Yeah, hello guys. So let's discuss some of the MCQs. FDA approved Food and Drug Administration, United States, FDA approved therapy for Alzheimer's or dementia includes all except means which is not approved by the FDA for this purpose. So guys, FDA approved the drug. First is rivastigmine, donepezil, yes. So you can remember the tecrin, then donepezil, then galantamine and rivastigmine. All these are cholinergic drugs. All these are cholinergic drugs and they are approved by the FDA. The other called tough dagger. Tough dagger, they are approved, but tacrin is banned because of hepatotoxicity. Tacrin is banned because of hepatotoxicity. Rest of the drugs are available. Donepezil is overall best. Out of this, donepezil is best. Rivastigmine is available in the transdermal patches form nowadays. It is available in the form of transdermal patch, as well as it can be given if the patient is having Parkinson's also, because it is not risky. So rivastigmine is the safe drug. It is available in the transdermal patch as well as in Parkinson's patients. Uh, Alzheimer's who are having the Parkinson's disease, it can be given. It is safe drug. Memantine is the NMDA blocker and that is also approved. Neostigmine is water soluble drug. It is not reaching to brain. So neostigmine is no use of neostigmine in the Alzheimer's. And remember nowadays one monoclonal antibody is there, that is aducanumab. Aducanumab is the monoclonal antibody and which is also approved for this type of patient, aducanumab for Alzheimer's. In Alzheimer's, these drugs are important. Overall best is donepezil. Then comes to next one, mechanism of action by which levetiracetam acts as anti-epileptic. So what happens, guys? This levetiracetam, it is the SV2A protein of synaptic vesicle inhibitor. It binds to this SV2A proteins in the synaptic vesicle. It binds to this protein in the synaptic vesicle. Suppose कर लीजिए this is the vesicle. It binds to this synaptic vesicle and inhibiting the release because it will have fusion and it will cause the release of glutamate. It will cause the release of glutamate in the synapse level. Right. So you can see this is SV2A and we are inhibiting this SV2A. It is not going to have the fusion with the membranes and these vesicles are not going to rupture and then glutamate will not be released. And that is the mechanism of levetiracetam. That is the mechanism of levetiracetam. So this is the important drug for first line drug for epilepsy. First line drug है nowadays. It is the first line drug nowadays. It is the first line drug in the GTCS as well as focal. It is the first line, not the drug of choice. First line drug. Drug of choice for focal is lamotrigine. Drug of choice for GTCS is valproate. And it is also least teratogenic. Is the overall least teratogenic drug. Least teratogenic is levetiracetam. One more drug is available nowadays, brivaracetam. Same group of drug. Next question. Drug therapy of alcohol dependence include all except, which is not the drug for de-addiction of alcohol or in the alcohol dependence patients. Naltrexone. Naltrexone is used in alcoholic patient. It decreases the risk of relapse. It decreases the risk of relapse because it decreases the craving. It decreases the craving of alcohol, anti-craving agent. It can be used. Disulfiram, it is the deterring agent. It is the deterring agent. Patient डरता है, घबराहट होती है. Deterring agent, antabuse, it can be used. Homepizole. Homepizole is acting over here. Like alcohol is converting to aldehyde, and this aldehyde is converting to acetic acid. So this is basically fomepizole, and this is disulfiram. So disulfiram is used for this purpose, but fomepizole is used for alcohol poisoning. Fomepizole is used for alcohol poisoning, whether methyl alcohol poisoning, ethyl alcohol poisoning. We can use the fomepizole. It is not used for de-addiction. Is not used for de-addiction. Acamprosate, that is NMDA blocker, and that is also for decreasing the craving. So disulfiram is deterring agent. Naltrexone, acamprosate are decreasing the craving, anti-craving agent, and benzodiazepines. Benzodiazepines are to treat withdrawal, to treat the withdrawal. That is the best way to manage this chronic alcoholic who are having the dependence. Because there will be withdrawal, the benzodiazepines are controlling the withdrawal. Acamprosate, naltrexone to decrease the craving. And disulfiram is for deterring anti-abuse. Next question. Drug used in Tourette disease. Tourette. Tourette means uncontrollable, repetitive movements. Uncontrollable, repetitive. That is Tourette. So what is the drug used in this case? So guys, in the Tourette disease, the best treatment will be clonidine. Nowadays, clonidine is the drug of choice. First line drug as well as drug of choice is clonidine. The second important drug is benazine, like tetrabenazine. These are dopamine depleters. Dopamine depleters, these are second drug of choice. And third is antipsychotics. Third is antipsychotic drugs used. Now let's see option. Benzatropine is anticholinergic. It is of no use. Rezaglin is MAO inhibitor. It is of no use. This is MAO inhibitor and this is anticholinergic. These drugs are of no use. Now we have the clozapine and haloperidol. Haloperidol is the most potent drug and it is the drug of choice for Tourette's and these patients who are resistant to clonidine and tetrabenazine. Nowadays the best choice or first choice will be clonidine. But not then we have the other choice, tetrabenazine, antipsychotic drugs are given. Antipsychotics are good, but not the first choice. And especially we use the haloperidol or typical antipsychotics only, not the atypical one. Next question. Morphine for pain is not to be used in MI, they are used. Post-operative pain, they are used. Terminal cancer patients, they are used. Biliary colic, no, never. They are not used for biliary colic. Morphine can aggravate biliary colic. It can aggravate diverticulitis. It can aggravate the pancreatitis. That's why it is contraindicated in these patients. Contraindicated. So if the patient is suspected biliary colic, that is most important. Diverticulitis in kids and pancreatitis, then it could be risky. Pethidine is less likely to cause the biliary spasm because of its anticholinergic property. So pethidine can be used. That is less likely. This is important about the pethidine. So morphine is not for biliary colic patient, but pethidine can be used for that. So biliary colic, diverticulitis, pancreatitis may no use because it increases the tone of sphincter. The answer will be D. Next question. Which anti-epileptic drug does not act via sodium channel blockade? So out of these, which is not acting via sodium blockade? Phenytoin blockade, sodium yes, lamotrigine yes, carbamazepine yes. Vigabatrin by name only you can see GABA transaminase inhibitor. GABA transaminase inhibitor, not sodium channel blocker. These are the drugs which are sodium channel blocker. Phenytoin, carbamazepine, valproate, lamotrigine, which are the broad spectrum. These are the broad spectrum drug, broad spectrum actions. You have the topiramate, zonisamide, lacosamide, rufinamide. GABA receptor acting drugs, barbiturates, benzodiazepines. GABA transaminase inhibitor, vigabatrin, valproate, gabapentin, antiagabin. So you can see valproate is still there. Ethosuximide, trimethadione, valproate, and lamotrigine. Again, you can see the valproate is there. These are calcium channel blockers. So this valproate and lamotrigine, these are wonderful drug. So does not acquire sodium channel, that is vigabatrin. And where to use this vigabatrin? This vigabatrin used for infantile spasm. The treatment of infantile spasm. Infantile spasm. But remember, drug of choice is ACTH. ACT is the drug of choice. So this is simple classification of the sodium channel blocker GABA receptor acting drugs. Which of the following is false regarding metoclopramide? I told you about the metoclopramide in the previous test. It is the D2 blocker as well as 5-HT4 agonist as well as 5-HT3 blocker. So extrapyramidal, yes. Due to this, there will be extrapyramidal side effects. It is true. Promote the gastric motility, yes, 5-HT4. So it is the prokinetic. So that is also true. Milk secretion, because it blocked the dopamine, so definitely it increased the prolactin secretion. It increased the prolactin secretion. So that is also true. Stimulate the chemo trigger zone. No, it will suppress the chemo trigger zone. Do not stimulate. It do not stimulate because it is D2 blocker, so it can suppress the chemo trigger zone. So this is about the metoclopramide. अच्छी drug है. It is mainly for prokinetic purpose. GERD patients. It is the good drug. Next, which of the following drugs or drug group is not useful in the prevention of nausea vomiting induced by cancer chemotherapy? Very important question. Cancer induced nausea vomiting. So which is used? Dexamethasone anti-inflammatory. Yes, they are used. Dronabinol. What is dronabinol? It is the cannabinoid receptor acting. Cannabinoid. So that is also true. Cannabinoid receptor. Ketanserin. That is 5-HT2 inhibitor. 5-HT2 inhibitor. Ondansetron. That is 5-HT3 blocker. So that is the best. So ondansetron is drug of choice in these patients. But ketanserin is 5-HT2 receptor acting drug and it is of no use. It is of no use, ketanserin. Even it can cause the nausea vomiting. So ketanserin is 5-HT2 blocker and it is of no use. Best is ondansetron. That is the drug of choice. Ondansetron is the drug of choice. We can use the dronabinol, nebilone also. In this we also have the nebilone. And steroids can be used definitely in these matters. Right? So this is important. Nebilone, dronabinol. Ondansetron is best. इसके अलावा we can use the neurokinin receptor, NK1 antagonist also, and these are pitants, aprepitant type drugs. वो late onset vomiting के लिए best. Next is drug of choice for treatment of NSAIDs induced peptic ulcer, because NSAIDs are inhibiting the COX enzyme, and due to inhibiting the COX-1, decrease PGE1, prostaglandins E1, and that's why there is erosion of gastric mucosa. So what should be the specific drug? Misoprostol. Misoprostol should be the specific drug, but that is not the drug of choice. Sucralfate H2 antagonist, they are not having any role in these patients. Mainly, we use the proton pump inhibitor, that is the drug of choice, or we use the specific drug misoprostol. Misoprostol is the specific drug, and PPIs are the drug of choice in these patients. Any etiology of peptic ulcer, PPIs are the drug of choice. कोई भी etiology, any etiology. In Barrett's esophagus, we give the lifelong therapy as well. Barrett's esophagus, pre-cancerous condition. Next, which of the following antimicrobials are used for eradication of H. pylori infection except? Which is not used. So basically for this, we use the triple therapy regimen or quadruple therapy regimen. Now in the triple therapy, we use the amoxicillin, clarithromycin, metronidazole. We use the 2 out of these plus PPI. Out of the 4 drug regimen, 2 antimicrobial, 2 antimicrobial plus PPI plus bismuth. But which antimicrobial? In this we use the oxytetracycline, and in this we use the metronidazole, mainly these two. But I have told you all the options. Amoxicillin, metronidazole, clarithromycin, yes, they all are used. So amoxicillin used, yes. Metrozole used, yes. Clarithromycin used. Ciprofloxacin is not used. Ciprofloxacin is of no use in these patients. In eradication of H. pylori, we use the AMC, amoxicillin, metronidazole, and clarithromycin. If there is amoxicillin problem, allergy and all, then clarithromycin is the good option. Bismuth compounds are toxic. They can damage the kidney. Hypophosphatemia. As well as bismuth compounds are causing the black tongue. Tongue will be black. Which of the following antibiotic inhibit the protein synthesis? Simple question from the mechanism. Doxycycline inhibit the protein synthesis. Nitrofurantoin acting via nitroradicals. Nitro-free radicals. Nitro-free radicals. These are nitrofurantoin. So radical injury. Cephalosporin and penicillin. These are cell wall inhibitor. All beta-lactams are cell wall inhibitor. So this is doxycycline. Doxycycline is the tetracycline. Tetracyclines are binding to 30S, you can see. They're binding to 30S ribosome. Tetracyclines. Right? And then they inhibit the binding of, this mRNA ribosome complex. Amino acid to mRNA ribosome complex. So this is protein synthesis inhibitor. Protein synthesis. You should know the cell wall inhibitors. In this, we have the penicillin, cephalosporins, beta-lactams, vancomycin, and rest of these are protein synthesis inhibitors. So this table is important directly. Then comes to child with phocomelia anomaly due to the drug taken by the mother. So that is thalidomide. It was taken by the mother or prescribed to the mother for the morning sickness. And after that we realized it is causing the shortening of the limbs. So seal-like limbs are there. Seal-like limbs. Seal-like limbs. Phocomelia defects. Teratogenic, most teratogenic category. It is the category X. This category X. Category X. Lithium to causing Epstein anomaly. Epstein anomaly. And tetracyclines, they are causing the difficulty in erection of teeth. Teeth and bone. Calcium. Okay. Next question. Which of the following drug is used for mass prophylaxis of meningococcal meningitis? Meningococcal meningitis. So guys, in the mass prophylaxis of meningococcal meningitis, in India, we use the ciprofloxacin as per WHO recommendation. Cipro. But in developed countries, they use the, suppose US में अगर बात करें तो they will use the rifampicin. Rifampicin. Right? Recent data saying कि either ceftriaxone or ciprofloxacin are best. तो treatment के लिए, in treatment the best is ceftriaxone. But for prophylaxis, ciprofloxacin. Right? So this is important. In India, we use the ciprofloxacin. In H influenza, we still use the rifampicin. H influenza में भी rifampicin. H influenza. This is for meningococcal. Which of the following drug is taken during the first part of the meal for the purpose of delaying absorption of dietary carbohydrate? So these are alpha glucosidase inhibitor. These are alpha glucosidase inhibitor like acarbose, voglibose. Acarbose, voglibose like drugs are there. And these are taken with the first part of the meal for inhibiting the absorption of dietary carbohydrates, which are disaccharides, interfering with the digestion as well as absorption of these. That's why flatulence is very common. Flatulence. Flatulence is very common with these drugs. Flatulence. Very common with these drugs. Yes. So these are the acarbose, voglibose like drugs. All are anti-resorptive drug for the bone growth except which is not the anti-resorptive. So guys, this reloxifene, alendronate, teriparatide, strontium. So strontium It is having both action. That's why it is having the resorption as well as formation. It helps in both. That is true. Teriparatide is recombinant parathyroid hormone. It is the recombinant parathyroid hormone, and it is inhibiting the bone resorption only. Sorry, this bone formation only. It helps in the bone formation. Recombinant parathyroid hormone fragment. It is for bone formation. Raloxifene is SCRM. Right? So this is also anti-resorptive because estrogen resorptive, anti-resorptive. Alendronate, that is bisphosphonates, and they are best. So teriparatide is the recombinant parathyroid hormone, and that is for stimulating the bone formation. Paratide. All statement true about carbimazole in comparison to PTU except longer half-life of carbimazole true. Less plasma protein binding true. That's why it is more distribution. More teratogenic true. Hepatotoxicity is more common. Hepatotoxicity and agranulocytosis, they are more common with the carbimazole in the first trimester. Carbimazole. Right? In first trimester, still PTU is better. So this is important. In first trimester, PTU. In second and third trimester, carbimazole. This is the way we use the anti-thyroid drug because PTU is safe. With carbimazole, there is risk of cutis aplasia. Cutis aplasia or aplasia cutis risk. So this is about the carbimazole or PTU. And that's all. Thank you. Okay, guys. Bye bye. Take care.